The next group of drugs that we're going to look at for Parkinson's disease include the indirect-acting agonists, also known as the COMT inhibitors. COMT stands for catecholamine O-methyltransferase. And the two drugs we're going to be talking about include N-tacapone and tolcapone, which are second derivatives of the grandfather drug Al Capone. No, that was a horrible joke. These drugs can prolong and potentiate the levodopa effect and reduce the off time when used as an adjuvant therapy with levodopa. These drugs are generally ineffective when given alone. N-tacapone blocks the catecholamine O-methyltransferase enzyme peripherally, whereas tolcapone blocks COMT in the periphery as well as in the CNS. And we always teach that tolcapone, T for total COMT inhibition, and T for toxicity. So this has got COMT inhibition in both the CNS and the periphery, and it's a little bit more toxic because it's in both compartments. These drugs increase the plasma half-life of levodopa. The most common side effects to COMT inhibitors are due to an increased dopaminergic stimulation, which can include dyskinesia, psychiatric effects, mainly visual hallucinations, but we'll talk about some of the other ones, nausea, diarrhea, and orthostatic hypotension. Both drugs may also cause a brown-orange urine discoloration. Tolcapone was removed from the market in Europe and Canada in 1998 after 3 reported deaths from hepatotoxicity in patients using tolcapone. However, these drugs remain available in the United States with a recommendation that it be used for treatment of motor fluctuations only after other methods have been exhausted with regular monitoring of liver function. This next drug, known as Stalevo, and this is a brand name formulation of 3 different drugs, is really important for Parkinson's disease therapy. And so pharmacologically, these drugs prevent the conversion of levodopa to dopamine in the periphery, so that's carbidopa, and they prevent the peripheral breakdown of levodopa, increasing the ability of levodopa to enter the brain, and tacapone. And they will also help reduce peripheral side effects. You can see an increased availability of levodopa, which may lead to smoother and steadier levels of dopamine in the brain. And this may provide better symptom control for longer periods each day. However, higher levels of drug can also lead to dyskinesias. Remember, bioavailability is different than availability. Availability is the amount that gets into the target, whereas bioavailability is the amount that reaches the systemic circulation. Another way to describe that would be to think of brain penetrance. And that's a topic that we will talk about again in the neuropharmacology component of psychiatry. Other indirect-acting agonists include the monoamine oxidase inhibitors, particularly inhibitors of monoamine oxidase type B. Selegiline and rasalgiline are both MAO-B selective inhibitors, and they increase the plasma concentration of levodopa by reducing the metabolism of levodopa. They have potential long-term enhancing effects on dopamine transmission because of complete and irreversible inactivation of monoamine oxidase type B, one of the main enzymes involved in the catabolism of levodopa. Selegiline is partly metabolized to amphetamine, and this is particularly important to remember because if a patient who has Parkinson's is still working and is subjected to random drug tests, trace amounts of amphetamine may show up in their blood. The clinical effect of these amphetamines is pretty much negligible, but most of the drug screens that are out there can pick this up, so that's important to remember that. Rasalgiline doesn't really have any metabolic activity to amphetamine, and so you wouldn't really pick that up. Nausea and vomiting are really the most common effects of the monoamine type B inhibitors. I do want to point out that there are lots of monoamine oxidase inhibitors, and we will talk about them in much more detail in the psychiatric portion of this curriculum. This is a nice summary chart demonstrating the selectivity of these monoamine oxidase enzymes. The ones that are used in Parkinson's disease are monoamine oxidase type B specific, and they are shown towards the top. The monoamine oxidase inhibitors are notoriously known for a kind of a unique side effect called the tyramine effect. And so tyramine is normally broken down by monoamine oxidase enzymes. In the presence of an inhibitor, you see an increase in tyramine, and this can result in the release of norepinephrine. Patients will experience sweating, tremors, dizziness, elevated blood pressure, and increased heart rate. We usually do not see that when treating Parkinson's disease patients. And the reason we don't often see this in Parkinson's disease patients is because the doses of the monoamine oxidase type B inhibitors used in this patient population is so small, we very seldom see this effect. We see this effect, the tyramine effect, in patients that are on monoamine oxidase inhibitors to treat depression. And so we'll kind of talk about this in a little bit more detail and review it conceptually in a few more cases. There are serious adverse reactions that rarely have occurred following the combination use of selegiline with tricyclic antidepressants or selective serotonin reuptake inhibitors. In practice, however, the vast majority of patients on these combinations are able to tolerate them for years. However, the physician's desk reference, or the PDR, warns not to mix selegiline with either tricyclic antidepressants or SSRIs due to the possibility of inducing a more dramatic tyramine effect. We will talk about this in much more detail in the psychiatric portion of this curriculum. Another drug that we should talk about for historical purposes is amantadine. And this was made in the 1960s to treat influenza and was coincidentally realized to also be a treatment for Parkinson's disease. Its mechanism of action is uncertain. It's known to increase dopamine release. It can inhibit dopamine reuptake. It can stimulate dopamine receptors and may actually exert central anticholinergic effects.